Hello, peeps, and welcome to another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire, and this is the Prescription for Better Living podcast, where our goal is to discuss all things health and wellness in a hip and relatable way. We are here so that we can promote health equity, so that we can reduce healthcare disparities and increase your health and wellness knowledge. So, whether this is your first time viewing our podcast or whether you are a repeat viewer and thus PBL family, you know I need you to do a few things for me. I need you to make sure that you subscribe to our channel. I need to make sure that you like the video, comment on the video, share it with everyone you know. I need you to stand and shout it from the mountaintops. Hallelujah, Dr. Carter is here. So we have been talking about all things sleep lately. We started talking about insomnia. We started talking about ways to combat insomnia with what we call your sleep hygiene. So if you missed that, go check it out. We then started talking about treatments for insomnia, some over the counter, some prescription medications, and we kind of talked about some of the reasons you may want to take those. We talked about potential side effects and all those things. So go back and check that out. Then we kind of started going into a discussion about sleep apnea. And I think we spent a good little bit on that, but I reflected and I felt like I still owed you some more in this area of sleep apnea, and particularly about what do we do about sleep apnea. It is a very deep subject. It is one that is always out there in front of us because we see on commercials the different treatments being advertised. You may even see on commercials about lawyers advertising about class action lawsuits about CPAP machines, and that may frighten you. So we need to get into that some more. So again, remember we set the scene for what sleep apnea is like, right? First, we're going to repeat the definition of what sleep apnea is. Sleep apnea is when an individual stops breathing so many times per hour. Remember we said that we all have some mild apneic spells while we're sleeping, but a normal person may stop breathing maybe 1, 2, 3 times per hour. That's normal in their brief pauses. But someone with sleep apnea is not breathing 5 or more times per hour, and the number of times that you stop breathing per hour dictates how bad or how severe your sleep apnea is. So you have some people that maybe stop breathing 6 or 7 or 10 times per hour. That may be mild. But you may have some people that stop breathing 100 times per hour. And that sounds extreme, but it's more common than you think. So not only do they stop breathing, but their oxygen levels drop to a dangerously low level, which is dangerous for you, for your health, and for your life. Remember, we talked about snoring, and we said that not all people who snore have sleep apnea, but loud snoring is a very common characteristic of someone with obstructive sleep apnea. We also talked about other risk factors like your anatomy, just pretty much how your bone structure and your facial structure is made, and there's nothing you can do about that. We talked about that opening in your mouth when you breathe, when you eat, when you swallow, and how narrow that opening is in your mouth. We talked about the size of your neck. And remember, I said I used to be about a size 18, 18 and a half, and I'm down to about a size 17 and a half now. But the thicker your neck, the higher your risk of sleep apnea. So a lot of times a doctor may measure your neck size. But what are symptoms of sleep apnea? Remember, we said that not feeling well rested when you wake up. So you could sleep 7 or 8 or 9 hours, but when you wake up, you feel like you didn't sleep at all, or you just slept a couple of hours. Excessive daytime sleepiness, such that it's very hard for you to stay awake during the day, especially if you just sit still, it's easy for you to fall asleep. Some people in its most severe form can stop at a stop sign or at a traffic light and then fall asleep. Or some people, if you go to the movie theaters and as soon as they let the lights down, you can't stay awake and you fall asleep. We also talked about people having headaches when they wake up in the mornings after they've been asleep. That could be a sign of sleep apnea. Or feeling as if your heart is racing, you wake up with your heart racing in the middle of the night. That could be a sign of sleep apnea. We talked about loud snoring. And I told you about a trick question that I ask my patients a lot of times when I'm trying to screen them for sleep apnea. I ask them, do you snore? And if they say no, I say, well, how do you know? Because you were asleep. So a lot of times the person's significant other can give you some very valuable information. So I talked to you about this loud snoring, right? Roar, roar. And my father, rest his soul, he had sleep apnea, I'm sure, before I ever even knew what sleep apnea was, as a child. I just knew that I didn't want to sleep anywhere near him because it was just loud, rumbling, could shake the walls, could shake your skin, snoring. And then he would have these moments where he got very quiet. And I thought at the time that he had just settled down and he was breathing easier. But no, it turns out that he was not breathing at all. And those quiet moments that I was waiting for were very dangerous moments because those were the moments when he was not breathing. You've heard of some people, there have been football players who have passed away in their sleep. There was a very famous defensive lineman who played, I believe, for the Green Bay Packers, who died in his sleep from sleep apnea. And that can happen. I also told you that I was diagnosed with sleep apnea, and I had very poor quality sleep. I was stopping breathing something like 50, 60 or more times per hour, and I didn't know. I thought that I was just tired all the time because I was a medical student and because I was a resident and I was sleep deprived. But it turns out that I had severe sleep apnea. And once I got treated for my severe sleep apnea, I woke up the next day and I was like, I feel so much better. I'm clearer. I'm refreshed. I have more energy. So that, in a nutshell, is sleep apnea. Well, what do we do about sleep apnea? How do we treat sleep apnea? I'm glad you asked. So the most commonly prescribed treatment for sleep apnea is what's called a CPAP machine, or you could say CPAP therapy or a CPAP device. CPAP. Well, doctor, what does CPAP or CPAP mean? I'm glad you asked. CPAP is an acronym for continuous positive airway pressure. CPAP. CPAP. What does CPAP or continuous positive airway pressure do? I'm glad you asked. By the way, try saying continuous positive airway pressure 5 times real fast. I bet you can't do it. CPAP therapy. Well, remember we said what happens in obstructive sleep apnea is that when the person is asleep, their airway gets obstructed, hence obstructive sleep apnea. Another word for obstruction is to block off, right? So what happens during sleep apnea is the person's airway gets blocked off. What blocks it off? They block off their own airway. They're not trying to, but what happens is that their tongue can fall back and block their airway. And then the muscles going down their throat, the muscles leading to their airway, collapse and close off their airway. And that's where a lot of that snoring comes from. So, what do we need to do about it? Well, one of the things we can do about it is to allow air to flow through the nose, through the mouth. Now, this is not like oxygen therapy, right? Where you see people walking around with a nasal cannula, which is the little skinny little tube in their nose, just delivering oxygen. That's not what this is, per se. What this is air being pushed through your airway that's strong enough to keep your airway open so that it doesn't collapse, so that the muscles and the tissues don't collapse. That's why it's called positive airway pressure. Now, does everyone have the same positive airway pressure requirement? In other words, is it one size fit all? I'm glad you asked. You know, because we asked the question, the answer has to be no. There are distinctions and differences. Some people can have a CPAP number that is 5. Some people, it could be 7, 10, and it can go up and up. Well, how is that determined? It's really based off of what your needs are. So how much air does it take in order to keep your airway open? How do you determine that? I'm glad you asked. Well, first, let's talk about how you get tested for sleep apnea. So when you get tested for sleep apnea, guess what you have to do? Go to sleep. But you don't go to sleep at home. You go to sleep in a sleep lab. And you say lab, how can somebody go to sleep in a lab? How can you relax enough to go to sleep in a lab? That sounds like it would be very uncomfortable. Well, sleep labs are made to look like bedrooms. They have furniture, they'll have chairs, and it's a fairly comfortable bed that you sleep on. But what you may not see are cameras around the room that are recording you. There are microphones around the room that are recording you. Now, probably the weirdest part of a sleep study when they're testing you for sleep apnea is that you have to wear little monitors on your heart so they can monitor your heart rate and heart rhythm. Also, they'll put a little tube under your nose to measure your oxygen levels, because remember we said people with obstructive sleep apnea, they stop breathing and their oxygen levels drop. Also, they'll put little sticky things on your head to measure your brain waves. Well, why do they do that, Dr. Carter? I'm glad you asked. They do that to make sure that you're actually in deep sleep. Sleep has a lot of different stages, and we want to be able to determine, were you in light sleep or were you in deep sleep? Were you in REM sleep, which stands for rapid eye movement sleep? That's the dream state, right? That can tell us about the quality of your sleep. So typically you spend at least one night at the sleep lab. Sometimes they'll want to bring you back for a second night, especially if the sleep study showed severe sleep apnea and they want to do what's called a titration study, meaning that they've diagnosed you with sleep apnea, and now they're going to bring you back for a second night, and they're going to determine how much of that positive airway pressure you need in order to treat your sleep apnea, right? Everybody is different, and they use something called the AHI, the Apnea Hypopnea Index. That's the number of times per hour you stop breathing. So let's say my apnea hypopnea index was 69 before they treated me with CPAP, continuous positive airway pressure. The way they know that it's working and the way they know it's a success is not by me telling them how much better I feel, but it's by them, again, documenting what my apnea hypopnea index was before CPAP and after. So in my case, let's say it went down from 69 times per hour that I stopped breathing all the way down to 5. That is a success. That's how they know how much air you need, how much pressure you need, okay? There are some machines that can adjust. So they start out at one pressure, and as you go to sleep, the machine can sense how many times you stop breathing, and the machine can auto adjust or automatically adjust up or down the amount of pressure that you need. So continuous positive airway pressure, CPAP. Well, doc, I don't want to wear CPAP. I know you don't. Some of it is because we think that it's going to be uncomfortable, and because some people have had initially a bad experience, but they quit and they didn't try something else. Remember, we said it's not a one-size-fits-all. So with CPAP, you put a mask on your nose, or sometimes it's around your mouth and under your nose, and you sleep in a mask. And people say, well, that's uncomfortable, it hurts, whatever. There are all kinds of masks for different faces and different people and different types of sleepers, etc. Like, I knew that I sometimes sleep with my mouth open. So I couldn't have a mask that just fit around my nose, because half the time I'm breathing with my mouth open, and that mask didn't do me any good. So I needed one that went around my mouth and under my nose, right? Also, there are different kinds of shapes of masks that can help with comfort. And then people say, well, I just can't sleep with this thing blowing in my face. It's uncomfortable. It feels like I'm smothering. Well, sometimes that's just more of a matter of strategy. Sometimes in your machine, you don't need to start out at the very strongest pressure that you need. Some CPAP therapy machines have what's called a ramp, R-A-M-P time. So You push the button on before you fall asleep, and it's giving a very soft, gentle kind of pressure. And as more time passes, it just gradually increases the pressure so that you are allowed to adjust to it and get more comfortable. But maybe even, hey, by the time that pressure gets fully up, you're already asleep and you don't detect the higher pressure. So some people are worried about comfort. Some people are worried about how it looks, especially if you have a significant other and you think that's just not a very attractive thing to go to sleep with this device attached to my head. I can tell you that if that significant other really cares about you, they would want you to be treated for your sleep apnea, especially once they understand the risk that is involved in untreated sleep apnea. Sudden death, stroke, heart attack, congestive heart failure, high blood pressure, diabetes, all are increased by untreated sleep apnea. Abnormal heart rhythms, atrial fibrillation, which can increase your stroke risk, all increased by untreated sleep apnea because that untreated sleep apnea is putting extra pressure on your heart and on your body, on your brain. So they care about you. They want you to get treated. Also, if they've been sleeping with you for any significant amount of time and you go to sleep before they go to sleep, they praying for you to get that CPAP machine because they're tired of hearing your snoring. And now that I have explained to them that those heavenly moments of quiet where you're not snoring are not heavenly at all, they're dangerous because you ain't breathing, homie. They would want you to get treated. Now, I tell you, I've been wearing a CPAP now for, my goodness, I can't, at least 7 or more years. And I don't think that it has adversely impacted my attractiveness at all. Because guess what you can do with a CPAP machine? If your significant other is feeling frisky, in the mood, all they got to do is tap you on the shoulder and you can pull that thing right off, sit it to the side, and there you go. CPAP gone. Now, some of you may be saying, I don't want to fool with those CPAPs because I see those lawyer commercials and I saw on the news about those recalls, that CPAP are dangerous, etc. What's that about, Doc? I'm glad you asked. There was a certain brand of CPAP machine that used a specific type of foam, this polyurethane foam, in order to make the machine more quiet, because some people say that CPAP machines can be very noisy. And in a small number of those machines, the foam started to break down and people would see these little black flecks or this little black material floating around in the water of their CPAP. And that was potentially dangerous because you could inhale that and it could cause injury to your lungs, etc. Well, in abundance of caution, the FDA, Food and Drug Administration, issued this alert to everybody. And the manufacturer, this company, and I'm not saying the company's name because I noticed that lately I've been getting copyrights on my videos. But you can look it up. Just go to fda.gov and you can search CPAP recall and you'll be able to know the company that I'm talking about. But this particular company issued a recall of all those CPAP machines. And some people they sent money to, money back. Some people they issued new machines that did not have this foam in them. Okay. So that's the deal on that. It wasn't all CPAP machines. It was really just this one specific manufacturer. And so even if you're spooked out by that, you can just use a different manufacturer if your doctor recommends CPAP therapy for sleep apnea. What are other alternatives? I saw, Doc, a commercial for just this little cool little widget device that I can just wave over my chest and it can help me breathe. What's that about? I'm glad you asked. This particular device, and again, I'm not going to say the name of it because I don't want any copyright issues, but this particular device is actually implanted in your body and it stimulates the nerves in your airway to keep them open. So some of you may have heard of individuals who have like chronic pain, chronic back pain, getting these nerve stimulators to help their pain. Similar kind of concept, right? And so it's a surgical procedure. You get this device implanted in your body, and when you're ready to go to sleep, you can just wave this little remote over the area. It turns on and it delivers little gentle electrical pulses to your nerve to keep that airway open. Personally, I ain't really wanting to have surgery. So give me my mask. I'm going to put it on. I'm going to sleep good. And that's just going to be the end of that. But that's an option for some people. Also, there's a surgery that people can get that actually opens up or thins out the airway, and an otolaryngologist or ear, nose, and throat doctor does that surgery. Also, some dentists sell dental appliances that you can sleep in that adjust your jaw while you're asleep to kind of keep your airway open. So there are options for treatment of sleep apnea. But the most important thing I want you to do is get yourself checked out if you have any symptoms of sleep apnea. Again, if you have a hard time staying awake, excessive daytime sleepiness, snoring, headaches when you wake up, fatigue, racing heart when you're asleep, your loved one tells you that they can hear you snore very loudly and they can hear you stop breathing and gasping for air in your sleep. If you have high blood pressure and you've been working to get that blood pressure down and you're exercising and you're watching your sodium or your salt intake and you are cutting back on your caffeine, you're losing weight, doing all those things, and your blood pressure won't come down, maybe you should ask your doctor about being tested for sleep apnea, because sometimes people with untreated sleep apnea have high blood pressure. Or you're even taking blood pressure medication and it's just not coming down to the normal range. Maybe you should ask your doctor, do I need to get tested for sleep apnea? Do you have chronic pain? And no matter what you do, nothing seems to really help your pain like it should. Did you know that untreated sleep apnea can worsen pain in individuals with chronic pain? So again, maybe you should ask your doctor, is it worth me getting tested for sleep apnea? It's a simple referral by your primary care doctor to a pulmonologist, that's a lung specialist that has done additional training in sleep medicine. They can do it, test you, and if they diagnose you with sleep apnea, can prescribe the appropriate therapy for you. So this, y'all, was my deep dive into sleep apnea and CPAP. And even though I spent all this time talking about it, I could go on for another hour talking to you about all the different types of CPAP machines and different types of pressure and all that. But I don't want to nerd out on you. I'm trying to give you the information that you need so you can be armed with accurate information so you can be a active participant in your own health and wellness. So, if this video is helpful to you, this podcast is helpful to you, you know what I want you to do? I want you to subscribe. I want you to share, like the video, comment on the video. And hey, if you have some topics that you want to hear about, email me. You can email me at contact@rx4betterliving.org. That's contact, CONTACT, at rx4betterliving.org. And I will, again, tackle your topic. If you have feedback for me, send it to me. Contact@rx4betterliving.org, or you can comment right down there in the comments. We are responsive. We'll respond to you. But share it with a few people, really with everybody you know. Shout it from the mountaintops. Hallelujah. Dr. Carter is here. Until next time, Dr. Carter, out.